Let's see NCLEX tips and points. Classification of tuberculin skin test reaction. There are mainly three ways in which we can classify. One is if the induration is 5 mm or greater, if the induration is 10 mm or greater, and the third one if the induration is 15 mm or greater. An induration of 5 mm or greater is considered positive in HIV infected persons, a person having recent contact with a person with tuberculosis, persons with fibrotic changes on the chest radiography consistent with prior TB, persons who are immunosuppressed, including those with organ transplants. These people are considered positive if the induration of 5 mm or greater is seen. In the tuberculin skin test, an induration of 10 mm or greater is considered positive in recent immigrants from high prevalence countries, IV drug abusers, residents and employees of high risk settings, mycobacterial laboratory personnel, persons with clinical conditions that place them at high risk, children younger than 4 years, infants, children and adolescents exposed to adults in high risk categories. The third classification is an induration of 15 mm or greater is considered positive in any person, including persons with no known risk factor for TB. The antiviral medications for the treatment of influenza and its route is given. The antiviral agent, its generic and brand name and the route. Zanamivir or Relenza. It is a medicine which is inhaled. Oseltamivir or Tamiflu, Baloxavir or Sofluza, Rimantadine or Flumandine, they are having oral route. And Peramivir or Rapivab is having an IV route of drug administration. Patients who have experienced neck trauma are at high risk for airway occlusion or obstruction. Have an emergency tracheostomy insertion set at the bedside and closely observe the patient for changes in the respiratory rate, respiratory effort, and the development of adventitious breath sounds. Regarding asthma, certain points are: absent or diminished breath sounds signify a decrease in the movement of air due to increased obstruction or respiratory exhaustion. And also, if a patient's wheezing decreases and he or she has little or no breath sounds, this indicates the patient is not able to move air throughout the system. This is a medical emergency. It indicates a respiratory failure. The patient may require mechanical ventilation. Hope you understood this video. Thank you so much. Please do keep watching.